Welcome everyone to the second episode of the series, Menopause, Body, Mind, and Spirit. My name is Jane Tawney. I'm a member of the Lisa Stewart Women's Health Center Advisory Committee. The Advisory Committee has always had a mission to provide education to our community. Two other very long-standing members of this committee, Linda Robinson, certified nurse midwife, and Julie Havener, community midwife, and myself developed this three-part series while we walked around carriage roads of Acadia, and we tapped the talents and expertise of wonderful people to give us all insights into this important life stage. Our first episode focused on the physical aspects of menopause and is available for viewing as it was recorded on the MDI hospital website. And today's episode will also be recorded and available. And I'll discuss how to access those at the end of our presentation. A few housekeeping reminders. All the attendants are muted during the presentation. If you have a question or comment, please use the Q&A or chat section of the Zoom feature, which is located on the bottom of the Zoom screen. And when you click on it, a place will come up to type a question, and we will monitor those and make sure they get addressed. We do ask that you remain anonymous for privacy reasons. Today we're focusing on the mind of menopause, and that is the mental health aspects and challenges of the perimenopausal years. And our panelists are truly awesome. Members of the counseling and medical professions, and I'm so pleased to introduce them to you. Ellie Panko is a licensed clinical social worker and a certified EMDR therapist, and has practiced in the Bangor area and on Mount Desert Island. She's worked at the University of Maine, Northeast Occupational Exchange, at the MDI Hospital Behavioral Health Center. She is currently in private practice here on the island. She works with adults facing a variety of issues: anxiety, depression, physical health challenges, chronic pain, helping clients navigate difficult and confusing life decisions. Ellie's particular interest is helping people address past traumas that are preventing leading a full and satisfying life. She uses well-researched approaches to resolve past trauma that focuses not on what is wrong with you, but rather what has happened to you. Next is Mary D'Alessandro, who is a licensed clinical social worker. Mary has practiced for over 30 years in a wide array of settings, working with college students, working with individuals and families around addiction and substance abuse issues, working in the employee assistance programs at the University of Maine and at Jackson Laboratory. She's a member of the Women's Health Advisory Committee. Her professional philosophy is collaborating with clients to identify and focus on creating strategies to achieve personal goals. Milja Brecher-DeMuro is a private practice licensed clinical social worker and the co-founder and owner of the Counseling Collaborative located in Bar Harbor. Milja provides psychotherapy to older teens and adults seeking to find more balance, hope, and peace in their lives. Milja's approach is strength-based, strongly rooted in self-compassion and resiliency. She is the only certified facilitator in the state of Maine of Brene Brown's Daring Greatly and Rising Strong work, and offers retreats in the exploration of vulnerability, courage, and wholeheartedness. Milja is also a member of the Lisa Stewart Women's Health Center Advisory Committee. Dr. Christie Seed is a physician who is a board-certified family physician. She founded Acadia Integrative Medicine, which is located in Soamesville, where she currently practices. She obtained her medical degree from the University of New England and trained at the University of Arizona in the Integrative Medicine Fellowship Program. She believes in building bridges between conventional Western medicine and complementary medical approaches. Her practice is a realization of her dream of practicing family medicine with a compassionate and holistic approach. So without further ado, let's talk. Ellie, you're on.
I'm on. Okay, it's my job today to begin by setting the stage for what's going on as we approach menopause or when we're in the middle of it. As Linda told you all last week, it is a medical event. You know, it's your last period. It's the end of all of that. But that doesn't just happen in a vacuum, right? It would be not so challenging if that was all that was going on, you know, that our bodies just stopped one process, began something else. But it's only one thing out of so many that's happening all at the same time. So many that I actually made a list. So I'll be a little bit looking at that. But so let's go down it. The first thing is that we're actually in the middle of our lives, you know, just actually in terms of age. For many of us, in terms of our work lives, we've arrived at a lot of the goals we thought we would meet at this point, and we haven't arrived at some of the others. So it's a time for reassessing our values, what we want going forward, what we need to change. So that's layer number one. Layer number two is family. Or if we have children, they're probably teens or they've left the house. If they're teens, that's already a stress layer that is difficult enough all by itself. But we are getting ready to have them leave, trying to help them grow into responsible adults, facing the fears that we all face when our kids are teenagers and have driver's licenses, all of that. And beginning to contemplate the empty nest. You know, what is our life going to look like once they're gone? And we're not in the really active phase of parenting anymore. So there's that layer. At the very same time, if we're lucky enough, our parents are still with us, but they're getting older. They're aging. They're at the time of their lives where medical issues begin to show up. And they need help. And if they're nearby, they probably need actual hands-on help. If they're not, you're worried about trying to figure out how to help them from afar. So that's another whole layer. I guess I will throw in a couple of the good ones because this all sounds so difficult, but there's also at the same time, you know, excitement at the changes that are personally coming. You know, you won't have fear of getting pregnant anymore. That's a big one for a lot of people. And you might actually be pretty excited about redefining who you are once your kids are not there, and maybe you're turning a chapter and deciding to do something completely different with yourself or move somewhere else, something like that. So there's that kind of excitement. All of this is stressful, just pointing that out. Let's see. Developmentally, it's a change point also, because for so many years, we've thought of ourselves as fertile women. And now all of a sudden, we aren't, or we're about to not be. And so figuring out what that means for us personally in terms of who we are, whether we're still attractive or desirable, or, you know, as you guys talked about last week, lots of physical changes. So that's another whole layer. And what else do we have? Lots of fear at this time in our lives around the changes that are still ahead of us and that we don't know a lot about, possibly, in terms of our own health, our own financial security, all of that kind of thing. The beginnings of just contemplating our own mortality. Like, all of this happens all at the same time. So, and finally, it's a new developmental stage. Anybody who took Psych 101 might know this, but the stage that we enter as we leave our fertile years and we're turning that corner is one that has more to do with legacy and what was the meaning of our lives? What is the meaning of our lives? What are we going to leave for our children, our communities, the world in general? So, you know, it's like you've been on a roller coaster and you've been heading up all these years and you're at the top. And that's menopause, okay? So there's all of that. So that's my first point, is like, it's completely complicated. My second point is that how well we manage menopause depends a lot on how emotionally healthy we are heading into it, okay? If we all lived, you know, June Cleaver lives, because maybe some of you are too young to even know who that is, but you know, happy with ourselves, happy with our partner, happy with our children, et cetera, et cetera. But it's a lucky few that get that scenario. The rest of us all have something. And all the somethings that we have can make menopause that much more stressful. So I'm just going to name them. The ones that I thought of off the top of my head, you all can add more later if you want to, but if you have chronic health conditions or chronic pain, if you're lonely, you don't have enough social supports, if you don't have financial security or even food security, these are things that, you know, are just like daily concerns. And when you're in the middle of mood swings and all of that, it just makes it that much harder. We might have domestic violence in our homes. We might not be happy with our partners anymore. We might have addiction issues. Someone we love might have addiction issues. We might have a really troubled child, or anybody else in our family for that matter. And being, you know, being women, what we do is take care of everybody. So we just have tons on our plate. If we also have a history of mental health problems or emotional health problems, we're bringing that into the mix. And that just adds another level of challenge to all of it. And the last one I want to mention is history of trauma, since that's my particular interest. If we've had a lot of adverse experiences, especially when we were young, we move into this phase of our lives maybe just not feeling on top of our game, because we've come to either not have a lot of self-confidence or not have a lot of trust. There's all kinds of things that can come out of trauma. But if you haven't dealt with any of that up to this point, that's also on your plate. So, so there you go. So just at the time that we need so much patience and resilience to deal with all of this, our bodies are playing this game with us. And we suddenly, our emotions are unpredictable, our energy level is unpredictable, and we start to behave in ways that just like aren't us, okay? And how do we know what's just normal transitioning through menopause and what isn't? So I'm gonna turn the floor over to Mary, because that's what she's got to tell us about.
Okay, thank you, Ellie. And I think that was a great sort of overview and platform. So I'm going to begin by talking about the mental and emotional symptoms that we associate with menopause. The first of these is irritability, and this is perhaps the most common one. One study found that 70% of those undergoing menopause report irritability. You find yourself getting easily annoyed over small things. The intensity of your feeling is not in proportion to the incident. You might suddenly be yelling at your kid because they left the milk out, or at your spouse because they forgot something you'd already told them and they're asking you about it again. You're impatient, you're grouchy. Another symptom is feelings of sadness. We may feel sad because we recognize that our childbearing years are coming to an end. Or as Ellie said, we may feel happy, but we're talking about sadness now. Or we may see menopause as a sign of aging, or being less attractive or less valued in society. Or we can feel sad and not have any connection as to why. Lack of motivation is also a symptom. We just don't feel like doing anything. We feel blah. It's hard to get excited. We procrastinate. Lack of motivation might be an indication that we're not getting enough sleep. We're going to talk more about that later. Anxiety is a common symptom. We find ourselves worrying about things, anticipating negative outcomes. We're fearful. In some cases, rare, we see panic attacks associated with menopause. Some, fortunately not a huge number, but some report symptoms of aggressiveness, strong feelings of anger, even feelings of rage. This is irritability ramped up tenfold. Aggressiveness may become more than just a feeling. We may act on it in ways that we don't think of as typical for us, screaming at someone, throwing something, which can be frightening to experience. Difficulty concentrating is another symptom. We become forgetful. We can't remember what we said 10 minutes ago. We find we can't listen or take in what others are telling us. We can't carry out tasks that we thought of as simple up until now. We can't multitask. So we start to feel really less and less effective. Fatigue is almost a universal symptom. We're exhausted, we're tired all of the time. Again, usually this is associated with not getting enough sleep. Mood changes and mood swings are another symptom. Our mood can swing suddenly and unexpectedly between any of the emotions I've just mentioned. For example, from being irritable to suddenly feeling anxious, or experiencing sadness to overwhelming rage and aggressiveness. This rapid shift can make us feel crazy because it comes out of nowhere. And finally, some of us will experience low libido. Our interest in sex and intimacy can diminish, and we may find it more difficult to get aroused. I don't need to tell you that any of these symptoms are really unpleasant for us to experience, but unfortunately, many of them are typically also not fun for our partners, our children, and our loved ones, and that makes it doubly a challenge. So I hope I haven't depressed you all or made you more anxious in highlighting these. My intention is to normalize these conditions and help you feel less alone. Menopause is a natural part of the life cycle, which means it is natural and normal to have some of these feelings. But natural does not always equate with easy. Giving birth is also a natural condition, yet most of us would want some support in dealing with that experience. So I like to suggest that maybe you can think of a therapist as parallel to having a good midwife in obtaining support for this natural life experience of menopause. So I want to talk a little bit now about how can I tell if I need or could benefit from treatment. I'm going to review 5 key questions quickly. Are your symptoms, whatever they are, interfering with your ability to function? Are they getting in the way of you living your life? You are the best judge of that. Are you perseverating? This means that you find you can't let go of something, you're rehashing it repeatedly, you're dwelling on it, maybe an annoying conversation you had with somebody last week or even last month keeps coming up and you can't get it out of your mind. You play it over and over in your head and get more worked up. Are you isolating? Because of the symptoms I mentioned earlier, we may find that we just don't want to engage with others. We avoid connection, we turn down invitations, and unfortunately, this instinct will only exacerbate the symptoms. And then 2 more really key questions. Are you having thoughts of wanting to hurt yourself? Or conversely, are you having thoughts of wanting to hurt others? In either case, whether these thoughts of harm to ourselves or others if they are only occasional or passing, it's probably okay. You know, I'm talking about something fleeting and infrequent, but repeated thoughts are definitely a concern. If they are intense or happening often, it's really a red flag. If you are wanting to act on these thoughts, it's a very strong sign, and I really would encourage you to seek help now. But even if you know you have no intention of acting on them, these thoughts are still destructive. They are corrosive. They eat away at the fabric of our experience, and they interfere with our ability to enjoy life. Therapy can be very helpful in learning to redirect these thoughts and discourage their ongoing presence. A couple of other important items to consider. I think Ellie touched on one of these. Menopause will exacerbate any existing mental health condition. So if you have a history of depression, anxiety, or any mood disorder such as bipolar, chances are good these will resurface with menopause. And in that case, we strongly encourage you to get a good therapist lined up so you can develop that relationship. And then lack of sleep, which is almost a given for most of us, due to the hot flashes and the other physical changes, can in and of itself lead to many of the symptoms mentioned, or certainly exacerbate them, particularly irritability and depression. Milja will say more about sleep, but because lack of sleep creates such a vicious circle for us, I want to emphasize it. We're irritated because we didn't sleep. We become more irritable and more agitated, and then that interferes with sleep the next night. So it really can feel like we can't win. What will therapy do? The therapy experience is as individual as we are, but we can highlight some common elements. Your therapist will get to know you and what your specific experiences and life stressors are. Therapy will help you identify strategies and techniques to manage these emotions. And again, Milja will talk about that more. It will help you examine belief systems that contribute to these symptoms or that are impediments to getting better. What do I mean by belief systems? These can be unrealistic, very high expectations of ourselves, or low self-worth, such as I don't deserve that, I can't ask for help, I don't have time for exercise, I don't have time for therapy, or even in regards to menopause, we may believe life is over or it's too late, ... Therapy can help you assess if your symptoms are creating problems in your relationships. As I mentioned earlier, it's sometimes difficult for our loved ones when we're going through this. And if so, it can help you make a plan on how to address that. Therapy encourages self-care, which is a crucial part of getting better. I just want to say a final thing. Menopause is a rite of passage in our life. It's a milestone. It's actually an accomplishment. Our attitude affects our experience of it, and therapy can help us develop a more positive and functional attitude. And I want to lead on to Milja now.
Thank you so much, Mary, and thank you so much, Ellie. So today I'm going to talk about sort of the three primary areas of where we can care for ourselves, you know, knowing all of these truths that are often challenging and overwhelming when it comes to perimenopause and menopause. So the three primary areas that I'm going to talk about today are self-compassion, self-care, and connection. So self-compassion is similar to the compassion or caring that you would feel towards someone that you care about who's struggling or suffering, but instead you turn it towards yourself. So when you know someone you care about is having a hard time and you recognize it with kindness and you empathize, maybe experience deeply what it may feel like, what they're going through, you may ask how you may be able to help or support them. So self-compassion is that same thing, noticing and naming that you're having a hard time, honoring that difficult experience, and asking, how can I be caring and helpful to myself right now? Self-compassion goes well beyond just being a nice thing to do for yourself. There's actually mounting scientific evidence that indicating that positive biochemical changes take place in our brains and bodies when we practice self-compassion. The practice of self-compassion releases oxytocin, the same feelings of connection and attachment and safety that gets released from a person breastfeeding their child, or when we receive a loving caress from someone that we care about. This leads to feeling safe and calm and a greater capacity to navigate the challenges in the day-to-day activities in our life. There are three components to self-compassion. There's mindfulness, which Christy will talk about in a little bit more, but that's naming and bringing awareness to how you feel without judgment. There's self-kindness, which is saying kind and caring things to yourself, like you're having a hard time right now. It's okay. This is really hard and exhausting. And then there's common humanity, knowing that you are not alone. Menopause is something that happens to eventually all people with a uterus as they age. Common humanity is knowing that there are people out there who felt the same as me. I am not alone and I am not broken. Self-compassion is a mindset and a practice. There are specific meditations that you can practice daily in order to strengthen your self-compassion. For instance, taking a few deep breaths, holding your hands over your heart and repeating, "May I be kind to myself. May I know common humanity. May I be mindful in my mind, in my body, and in my heart, and in my day." This practice builds a powerful neurological network of self-care, moving us to greater well-being. When we are kind and loving and nurturing to ourselves and others, there's a better chance of thriving. So I'm totally aware that that can sound completely woo-woo to some of you. And trust me, I totally get it. But think about the opposite, which unfortunately many of us are very familiar with. Imagine struggling with anxiety or depression and saying to yourself, "What's wrong with you? Why are you such a wimp? Suck it up. People have it worse than you." Imagine if that voice was an actual person, negatively commenting out loud on every move that you make, every bite of food that you take, every outfit that you wear. It would drive you insane. It would make you feel horrible, and it may lead you to wanting to numb out with food, with alcohol, with sleep, with shopping or work or anything to get you away from that negativity. And so when we're cruel to ourselves, we beat ourselves up or we shut down. So when we show ourselves compassion and practice self-compassion, we are more kind, we are more open, we are caring, and more likely to take better care of ourselves and those around us. So self-compassion is a very powerful practice and costs nothing and literally takes minutes a day. The next component of navigating our emotional mental well-being is self-care. Self-care includes food. What are we eating? Eating healthy foods nourishes our bodies and our minds. And I'm meaning whole grains, fresh fruits, vegetables, low-fat proteins, and healthy fats. And I know that they talked about that a little bit more in the last presentation for menopause, these menopause talks. So look at that one again. Sherry Olson speaks a lot to that. Sleep, as Mary mentioned, is really vital. Sleep hygiene is vital really at any age. Adult bodies generally need about 7 to 9 hours of sleep. That definitely varies between people, so you kind of know what you need, but that's kind of an average to think about. We have to turn electronics off at least an hour before going to bed. This is really hard in our modern society, especially like if your phone is your alarm clock or, we just have it next to us. But it's really important. And going to bed at the same time every night and waking up around the same time every day, even on the weekends, helps with maintaining your body's natural rhythms. Good regular sleep helps with irritability. It decreases stress and helps us make healthier food choices so that we feel better in our bodies. And then there's exercise. Moving our body improves how we feel about our bodies. It produces feel-good hormones and decreases stress. And one reason it helps with stress is because it's one of the most effective ways to help us complete the stress cycle. We live in a stressful world, even beyond our bizarre pandemic lives. We're paying bills, we're working jobs, we're caring for children, maintaining houses, navigating health issues, all of the things that Ellie mentioned. There's tons on our plates. And often we cannot get rid of any of those things because they're all so important. But what we can do is get smarter about how we manage that stress. We've all heard of fight, flight, or freeze. This is what we know as the stress response in our bodies. Our brains get activated by either a perceived or actual threat, like a work deadline, a sick kid, an aging parent, a sleepless night, and our body reacts to shifting into a response of self-protection by wanting to fight, wanting to run, or wanting to shut down. But usually in the types of modern stressful situations that we have these days, it's not really appropriate to run or to fight or to play dead. So what we have to do, or what we normally do, is we swallow it, or we stuff it, or we eat it, or we drink it, or we throw hate on social media, or we participate in some unhelpful self-loathing. And unfortunately, these behaviors often do not actually complete the stress cycle. It just stores it until we eventually explode, get sick, or have a breakdown. In order for us to really feel better and for our brains to reset, we need to burn the stress all the way through. Exercise is a great way to do that. 20 minutes or more of high energy movement can reset your stress response. Less stress equals less irritability, better sleep, make you feel better in your body in general. So self-care also includes finding time for what feeds and fuels your soul. Art, listening to or playing music, writing, creating, reading, exploring, sitting in the window with a cup of tea, getting a massage, brushing your hair, having someone else brush your hair, sitting in the sun, reading poetry. The list of leaning into what you love can go on and on. And last but certainly not least is connection. It's been hard to come by over the last year, but it is vital to all of us and plays a huge component in self-compassion. Connecting with other people, navigating similar challenges, whether it be the stressors in our life or the physical changes we are undergoing. To share our authentic truth and experience with others going through the same is incredibly grounding and comforting. It doesn't necessarily take the difficulty or the stressor away, but it helps calm down that pesky negative voice in our head and helps us not feel so alone. We are all so much more similar than we're different. Connection can look like connecting with friends or family, partaking in a support group, or connecting with a life coach or a therapist, as Mary mentioned. This pandemic has done actually one really good thing, and it's made therapy and counseling available on telehealth, which means that you have the entire state that you live in available to you of therapists. When it used to be, who could I drive to at my lunch break, is now the entire state. There's an amazing website for you to check out, which is psychologytoday.com, where you can search for a therapist based on their expertise, based on the insurance that they accept, or if they have a sliding fee scale, what gender they are, what age they are, what their orientation is. There's so much that you can look at right at your fingertips and get a feel for who they are out there. So if you are interested in looking for a therapist, that's a great place to start. And then I have a bunch of podcasts. Oh, I think that did I miss something here? No, I didn't. So I have a bunch of podcasts and books that I think are really great for you to check out that I believe that Carly and the Women's Health Center will forward to you that talk about, the different stress responses and things like that I talked about in my talk. And so I'm going to pass you along to Christy. Thank you.
Thanks, Milja and Ellie and Mary. Those are really helpful insights. I'm going to talk a little bit about what Milja brought up, which is the use of mindfulness or meditation in menopause and helping with some of the symptoms, both physical and emotional. I find it's easiest. I'm a visual person, so I enjoy slides. So I'm going to share my screen now so that everybody can follow along with a few pictures to go with my presentation. Often I find it's very difficult to explain mindfulness. When I teach a mindfulness-based stress reduction course, I take a whole hour to discuss mindfulness, but I'll try and sum it up in 1 minute. And I like this slide because this image for me really defines what mindfulness is. First, I prefer the term mindfulness over meditation because it's a more secular term. And I don't know about all of you, but much of my life I have found myself living in the thought bubble on the left-hand side of my screen, where we have all sorts of thoughts and things happening in our minds. I don't know about you, but I often feel like I'd rather be in the thought bubble on the other side, where somebody is practicing mindfulness, where they're there on their walk with their dog, really just being present to the situation, appreciating the sun that's out there, the trees and the dog, and able to let go of a lot of the other thoughts that are running through their mind. Jon Kabat-Zinn is the grandfather of mindfulness in medicine, in my opinion. He works down at the University of Massachusetts and developed a lot of studies about mindfulness in medicine and the effects of mindfulness on medicine, on different medical conditions, including menopause. And his definition of mindfulness is paying attention on purpose and without judgment. Easy to say, really a hard thing to do, which is why we talk about mindfulness being a practice and not an accomplishment. I'm going to share two studies that just show how profound a mindfulness course or learning some mindfulness can be on our physical and emotional states. The first study is about the effects of learning mindfulness on our perception of pain and discomfort. And the second study I'll talk about is more specific to menopausal symptoms. So in this first study, which actually is quite complex, but I'm going to boil it down to, there were two groups of participants. In the first group, the participants had 4 20-minute mindfulness classes. And then in the control group, they gave those participants 20-minute relaxation classes. So both groups got something. And then they went ahead and subjected each of these participants to a painful experience. In this case, it was applying a very hot probe to their forearm, not hot enough to burn, but hot enough to cause significant discomfort. And they asked the participants, they said, please rate your pain. And what they found is that in the group that had the mindfulness course or treatment or practice, that they reported a 40% reduction of the intensity of the pain of the probe. And more importantly, they reported a 57% reduction in how unpleasant the pain was. And it's this 57% reduction that I think is most important when we talk about menopause, because often we can't necessarily alleviate the symptoms. Often hot flashes are going to happen. Often the emotional struggles, the brain fog, those things are going to happen. But how we react to these symptoms is more in our purview and amenable to mindfulness practices. To give you an example of what does it mean, the unpleasantness of pain, if you go for a massage and you have a really strong massage therapist and they're working on a knot in your shoulder, it might hurt, but it's that good pain, that feeling of, oh, there's a purpose in this, and you're okay. You're able to tolerate much more and probably are even grateful for what's going on. That's where using mindfulness can be hugely helpful in menopause. It's changing our perception of the symptoms and the experiences that we're having. This study further, just to give you a kind of comparison, when we prescribe potent pain relieving medications such as morphine or narcotics, we typically would expect about a 25% reduction in pain with those. So if you go back to the effects of mindfulness, and this is a pretty short intervention of 4 20-minute classes, that's pretty dramatic, and there's no side effects. The other study I'm going to mention today is specific to menopausal symptoms. In this study, they once again had 2 groups of people. One group had an 8-week mindfulness-based stress reduction course. That's the course that John Kabat-Zinn developed up at the University of Massachusetts. And then the other group, they put on a wait list for that they eventually were going to get this mindfulness course. And then they asked the 2 groups of participants about their menopausal symptoms before they had the course and before they were put on the wait list, and then 8 weeks later after the one group had had the course and the other group had not. And what they found is specific to menopausal symptoms, there was clinically significant improvement in both the quality of life, the sleep quality, anxiety, perceived stress, all the things that Mary and Ellie and Milja were talking about as far as the negative aspects of menopause. So these are 2 studies. There are many more looking at how profound mindfulness can be on improving symptoms of menopause. So the next question is, all right, that sounds pretty good. I want to figure out this mindfulness thing. What do we need to do? Do we all need to become monks? And fortunately, no. I'll come back to this first slide that I showed. To me, as I've learned more and more about mindfulness, it's less about the time that you necessarily spend sitting on a cushion or following your breath. I do think those practices are very important and helpful because they help train you and your mind on how to go from the thought bubble where there's all sorts of stuff going on to being present in the situation, so that when you are on that walk with your dog, you can be present to your dog and the sun and the trees. Or when you're having that hot flash, that you can be present to, yeah, this is uncomfortable, but this is a stage of life. I had an interesting experience when I got my second COVID vaccine a couple weeks ago, in that I felt pretty crummy that night. I felt like I was coming down with a sickness, some sort of cold or flu. I felt achy. I was, had some pretty significant side effects. Everybody should still get the vaccine, even if you have some side effects, because in the midst of this, I didn't have any of the anxiety or stress about, oh dear, I'm getting sick. How long am I going to be sick for? How many activities am I going to have to curtail because I'm sick? None of that was there. Instead, there was this immense sense of gratitude that my immune system was doing what it was supposed to be doing and becoming resilient if I were ever exposed to COVID. So it was a really neat moment to kind of look at how powerful our perception of our discomfort can change how we react to that. There was no anxiety involved. So if you're saying, how do I get started? Where do I learn about mindfulness? I have 2 apps that are very helpful. Headspace is a app that you can download a free 10-day trial, and it's 10 minutes a day commitment for 10 days. And then there's multiple other things under the paid app. But if you're curious about mindfulness, just want to kind of start checking it out, the free 10-day trial is excellent. The other app that I highly recommend is called Insight Timer. This has over 70,000 different guided meditations and courses and mindfulness practices, including many about menopause and the transition and womanhood. Finally, if you're interested in going for the 8-week mindfulness-based stress reduction course that I mentioned a couple times, you can get all the free curriculum and the course that's self-directed at paloussemindfulness.org. The most important thing with mindfulness is to just get started. And that's all I have.
Thanks, everybody. Let's see, Julie, you want to field the first question? You're muted.
Yeah, I got it. One question that I see is, the question is, are there any therapists who specialize in perimenopause or in menopause? Is that a thing? Does anyone know of?
I believe I've seen, I don't know of anybody in particular, but I believe, again, on that psychologytoday.com website that there have been people who have specified saying that menopause is something that they particularly have an expertise in. And so I think that maybe looking on that website, but not somebody off the top of my head specifically around menopause.
Yes, I'm not aware of anyone locally either.
Yeah, neither am I.
I will say though that you're all experienced practitioners. Menopause is the time that it arrives, which is in the 40s and 50s, is often a time where, that, as Ellie mentioned, it's a time of life reassessment. So a lot of people go into therapy at that time in their lives because there are a group of the whole constellation of things, relationships, family, disappointment in maybe professional accomplishments, or concerns or questions about what's the next stage of my life. And menopause sort of is just, menopause is just a normal event, but it's a surrounding at a time when a lot of other things are happening. So I think it's part and parcel of a time when you're all specialized in that kind of transition time. To me, I just want to say that when you were talking, someone like, when Mary was talking about irritability and aggressiveness and throwing things, I just want to say I've been there and did that. So, it's pretty surprising when this person who's known as like kind of this Midwestern stoic person threw hissies in her 40s and 50s. That was pretty incredible.
Well, I want to sort of say, just in response to that the aftermath of that type of reaction also then can create a shame response, right? And so it ends up feeding such a negative cycle. And I mean, it's kind of what Christy was saying, is that in shifting our mindset around really honoring this transition in our body, and some people might be like, screw you, this really sucks, you know, and I don't want to take that away, because you're allowed to have those feelings, but but the mindset, you know, to not fall into that shame pattern of like, you know, why is this happening to me? I can't control myself. Who am I anymore? I don't even know, you know, that the mindfulness practices or the exercise or these different ways of, you know, going to therapy, connecting with other people who are navigating this challenge can be so grounding, you know, to be careful to not fall into the beating yourself up shame spiral, you know, you know, of that reaction, you know, because that's even more dangerous.
I agree, and just want to add, and thank you for that, Milja, but what we're trying to do here is to normalize that this wide range of symptoms are something many of us experience, and that there's no shame. In fact, it's really an act of courage and self-care to think about getting help if you need that.
I find also a sense of humor goes a long way. You know, if you can hold on to that. There is another question here. Someone would like to know about medications that may help with the balancing of moods, like Lexapro, or what else is, what are your thoughts?
So I'll field this one just because often people end up in my office when they're looking for something beyond the mindfulness. And it depends on what the symptoms are. If they're real physically based, as far as the the hot flashes and vaginal dryness, etc., then using hormone replacement therapy is the first go-to. Unfortunately, there's significant side effects or potential downsides of hormonal therapy. So often it's a matter of, okay, you know, balancing of the potential side effects with the symptoms that a patient is having. And sometimes I always let people know, a lot of times when you feel like there is nothing out there, there's such a sense of hopelessness. So often the conversation I have with patients is, yes, we can absolutely do hormonal therapy. This is when you feel like you need something that is available for you. And I find a lot of patients just knowing there is a treatment, that in and of itself is enough. And a lot of times the response is, no, I'm okay. I really don't want to take on those potential risks or side effects. But knowing that that's there is a possibility. For the emotional side, as far as if somebody's really struggling with the depression or anxiety, then we have the multiple classes of medications, one of which is the serotonin reuptake inhibitors that can be very helpful. Those fortunately don't have as many adverse reactions, and I have to say that my question to patients when we're considering those is, how much are these symptoms affecting your life? And if they say they're really impacting my life, I say, all right, here are your options. You know, we can go with the mindfulness route. We can go with herbals. We can go with a pharmaceutical. And again, I think a lot of times when somebody's having symptoms related to menopause, it's knowing that there's options and that they're in control and can choose what to do out of that, rather than being stuck in these symptoms.
Yes, and another person would like to hear more about herbs and foods that help, which we did address some of that in our last menopause talk, which you can find on the hospital Facebook page or website, but we can certainly touch on it now if someone would like to address that.
One of my favorite herbal supports for menopause is from Avena Botanicals. It's called Menopausal Blend, I think. I can't think of it. But it has a combination that Deb Sewell, who's the herbalist down at Avena Botanicals, is exceptional. And I've had patients have significant success with that. As far as foods, eating an anti-inflammatory diet, whole foods, these have all been shown to reduce the inflammation that comes along with menopausal symptoms. There's a whole lot more, and I imagine that was addressed in the session before this one. So
And also Deb Soul does do consultations, and I believe she does them over the phone. I'm not sure if she has openings right now, but I know people who've really been helped by her.
And one of the
different
things that was
stages of
mentioned in the last presentation was how individual it really is. And so it really is important to have that expert consultation in order to determine, you know, what would be the best supplements, or really what are the best, you know, foods in particular that would be helpful for you to eat or to eliminate from your diet in order to benefit those symptoms.
I just wanted to add something about both being connected and feeling and sharing experiences of going through this life stage, that it's really important to have girlfriends. And it's great to have girlfriends that are around your same age, that are, you know, have kids that are going through this. It's a little easier when you have kids because you connect during, you know, kid activities. But one thing that's really helpful and can still happen during, you know, the isolation that we're having with social distancing, it's possible to just go for a walk with a girlfriend and talk about what you're going through. I mean, just like what Jane and Mary was saying, it's just to express out loud the things that you're experiencing and the frustration, and then to hear that someone else is going through it too, can be pretty powerful. And so you're addressing, you know, there's a connection, there's exercise, and there's sort of, you know, a release of frustration. So that's very doable even now with the situation that we're in with the pandemic. But it involves taking a step to like make a call, and often that's a little bit difficult. So I mean, it's almost, what I like is just to sort of give a prescription. I mean, this is an assignment. Like, call a girlfriend and set up a time and go for a walk and just share whatever that is. And often that's really therapeutic.
I agree. And another person wrote in and said, you know, during this last year, people are just climbing the walls. It's this COVID. Oh, you're just so tired of it, and you're just. There's been a lot of isolation for people, but you can walk outside now. You know, we happen to live in kind of a beautiful place. Right now, I'm in Chicago, and I'll tell you, this place has 22 inches of snow. It's a big slush farm right now. It's you know, it's a busy place, cars going past, but you still, just a walk around the block is good. And so we talk about exercise, but you don't have to just walk fast. We have, you know, just walk. If you can. And I know a lot of us have hip problems and knee problems and ankle problems, but even 10 minutes, 15 minutes, 5 minutes, just breathing air, just that's not your house air, is incredibly, and it helps hot flashes too. You know, here you are just dripping in sweat. Walk outside where it's kind of cold in a t-shirt. You'll cool off, you know, and it's true. So it's very, it's just, you know, what you got to do, but people are really not, you know, just so in need of connection. And Linda, you're right. You just have to, you know, just make that, it's hard to sometimes to get together with somebody and say, you know what, I feel like crap sometimes, you know, or I hate my family. I mean, you know, that's a big thing to say, but you do hate your family when you're in menopause sometimes. They're just so irritating. But part of you knows it's like, they're not doing anything different. I'm just responding differently. Where'd that come from? And it's important to put it out there, because suddenly you sort of like go, oh yeah, okay, I get it. I'm understanding this. And that's very powerful.
And yes, I am in the middle of menopause, and I do say to my family, I'm like, this is what's happening. So you all can read about it, or you can ask me questions, but this is like a thing, so I need some space. And please don't crunch your corn chips in my ear.
I just
Right.
want to pick up on that, and particularly what you were saying, Jane. I think so often, and what Milja was saying earlier, we shame ourselves, we feel something, and we don't realize that if we share it with a trusted friend, we not only are getting the opportunity to vent, but so often they will say, oh my God, I feel the same way. And there's this incredible relief for them that they're not alone either. So you're really doing a great kindness by being able to take the risk to let people know what's going on with you.
I wanted to ask Ellie, do you find that there are, do you see a thread in past traumas that trigger responses in menopause? Are there common threads that you've seen in your practice?
Well, I could speak about that generally, but actually in my practice, not that much. The kinds of problems that come from trauma have to do with not trusting yourself and not trusting others, feelings of powerlessness, that kind of thing. So they're not specific to menopause, other than the sense of aging as a woman and losing your place in society. We haven't talked about that today, but older women sometimes feel kind of shelved and kind of forgotten and useless, and that begins in menopause, or can be exacerbated by menopause. So,
and there can also be that now we are looked up to with wisdom, which is what is the flip side of that. There's an exciting question here that we have discussed as a group outside of this forum, wondering if the Women's Health Center ever facilitates ongoing women's discussion groups for this stage of life. And this person in particular has been looking for and hoping for that. And we did discuss that and have been contemplating moving forward with something like that. Milja, in particular, you were speaking to that the other day.
I'm getting all fired up about wanting to do groups. I mean, it really is something that is just lit me a fire again, because it is so powerful, just like what everybody's been saying here, that when we can sit with people who have had shared experience, it changes everything. It doesn't take away, but it shifts the weight of it. And so, yeah, I think that I've got to figure out a way to make it happen. I will say that what has been difficult, and I hope that anybody considering participating in a group, is that they don't let this be a roadblock for them. But we're in a small community, and so it's hard for people to be like, I'm going to go sit next to my neighbor and talk about, my hot flashes or my weight gain or my, how much I hate my husband, who is your child's school teacher. It can get complicated, but just like Mary was saying, is that oftentimes when we get together, we find out, we're much more similar than we're different. And it's such a beautiful invitation for somebody else to show up with their own story. More often than not, what I hear, when I have had groups and had that amazing opportunity is, oh my God, me too. And it was like the most difficult, courageous thing for somebody to speak their truth, and then to have 2 or 3 other people in the group be like, yep. It's so powerful and amazing. So I am churning in my brain about, how to make this happen. And again, because of telehealth, because of this opportunity, it actually makes it a lot easier to connect with people. People don't have to drive to a certain appointment or can take their lunch break or whatever. So anyway, wheels are turning.
Well, someone says, amen, Milja, you say it, sister. So there's that comment. And then someone else is speaking to the end of group possibly being, like AA or Al-Anon, in a way that would be very confidential and a safe format, and like making sure that's in place would feel important to a lot of people, I'm sure.
And one of the goals of the advisory committee at the Women's Health Center is to sort of tap into the needs, the needs of the community and the interest of the community. And that's how this forum came about is, we were hearing from some women that they wanted something on menopause. And so we created this series, with the restrictions that we had because of the pandemic. But, we hear you. And this is something we can bring forward at the next advisory meeting and see how we can develop it into maybe some ongoing group. So I really appreciate everybody's, feedback and interest in this because it guides us when we're developing new programs. And so we will definitely take this into consideration.
Your mute button's on, Mary.
Unmute.
Thank you. I also want to add that if any of you out there are thinking you might enjoy that, I think you could let anonymously or confidentially let our hosts know, and we could be thinking about putting together some kind of a, whether it's a 1 or 2 or 3 session thing and maybe take it off from there. I mean, jump off from there, but I let us know if you're interested.
Absolutely. Email any of us, email the Women's Health Center, call and say, talk to friends, acquaintances, co-workers, and say, anybody interested in doing like a little group support group is what it is. And yes, and it can be confidence and everything stays in the room, things like that. They're incredibly helpful. Jules, we got any more?
I think, well, my impression is there's been already 3 people interested in such things in our calls here. Up 1, 2, 3, 4. So I think we might not need to wait for our next meeting, Linda, like you're saying, and we can maybe move forward and sort of contemplate this together. So
people are putting course. Let me know. Yeah.
Yeah. And there will
and
be.
We have everyone's email who has joined us today. So anything that's developing, we will certainly put out on the Facebook page, the website for the hospital and the Women's Health Center, but also each of you who are on this will get an email with any progress about that, or when we have progress about that.
Well, our time is drawing to a close, so many, many thanks to Ellie and Mary and Milja and Christy, Linda, Julie, all of you, and for everybody that's out there listening. If you have any, as we just said, if you have further questions, concerns, thoughts, don't hesitate to reach out to us. We will get back to you. As I said before, a list of resources is included along with a recording of this event and of the last episode. If you want to hear a recording, it's located on the MDI Hospital website, which is mdihospital.org. You click on Health Centers, you scroll to Lisa Stewart Women's Health Center, you click on it, and if you scroll down their screen, on the right, you'll see recorded that there's recordings of these 2 sessions. So it's pretty easy to find. I just want to say our next presentation will be in a month on March 31st, same time, 3 to 4 Eastern Standard Time. And that will be focusing on menopause spirit. And I think that for that, it is what it is entering into a new life phase, the losses and gains, what it is to be an older woman, that transition and an emergence of a new faith and some wisdom. So we hope to see everybody then. And in the meantime, health and peace be with you.